121,000, 5,074 cases, 63,000 active cases, 44,000 deaths. India continues to grapple with an unbridled increase in the number of COVID. Good afternoon, everyone. I'm Rohit Gandhi, and I welcome you to our show, It Matters. Now, this show is about trying to, bring some clarity on what's going on. We are dealing with a very important issue today. The COVID crisis is literally brought the Indian economy on its knees. But beyond that, the first thing is that the crisis is still not being dealt with. I decided to do this show because there are certain gaps that we as citizens see when we go out, and they're not addressed. Just this week, I was on the border of Uttarakhand as I traveled. Lo and behold, we were stopped and asked to come inside for a check of our temperature and to see if we are okay. Great decision. But as I walked into that location, there is a video which I captured, you can see it. I saw there was no social distancing being maintained by even the medical staff and the people sitting there and the police officials sitting there. Beyond that, I saw a bunch of people standing there in queues. There was no social distancing. Half of them weren't wearing masks. We had some children with us who we were taking. We said, we can't be bringing our children into this environment. This is absolutely, it's a sure way of trying to give COVID to people who are coming to that little location. And that's not, how you operate. There has to be a methodical way of doing this. You keep people in their cars, go on the highways, check their temperature, and let them go quickly, and don't establish these long queues. If you do not have the resources to handle movement of people, then don't stop them to start with. Stop them at the edge of communities. And I think that's where a lot of the challenges come in. When you cannot have barriers to stop COVID, not physical barriers. It has to be more to do with education. It's got to do more with, being a little more alert how you're going to control diseases. And one of the biggest challenges that we've seen because of this is the economy, which has come down to its knees absolutely. We're in a state which many don't know when it will recover, how they will recover. I was talking to a restaurateur. He said, they've asked us to open restaurants, but I'm paying, rentals worth like 30 lakhs a month. How am I supposed to recover money by food? Don't sell alcohol. My restaurant is unviable. Let me shut it all down. Let me, fire all the people and let me go on. So not understanding how businesses work and not knowing how to do this properly is not going to help. The economy is going to crash in a weekend. You shut everything down and there's no business happening. How are people going to come back up on their feet again? You'll wait for a drug, you'll wait for a vaccine for it to return. You're talking about a year and a half or two by the time the vaccine's in and people have been vaccinated. So having a strategy is important. What will it take to have a strategy? Who are you going to need? Is the government employees capable of handling this? Absolutely not. If they were, we would have a working city with good facilities. Is the healthcare department capable of handling all of it? There may be a few great hospitals in this country, but this country is 1.3 billion people, which is 1/6 of humanity. Do you have the 1/6 of humanity's medical equipment and people to handle this crisis? Absolutely not. If the government was able to do it, then our education system wouldn't be what it is today. So please have the sense of getting in the people who will be able to run this, people who possibly have run a company, the IT sector, for example, who've been able to, say, all right, we're going to be able to handle it. So you need the right kind of people to handle it. It's not going to happen with this old mentality of putting security checkposts and police checkposts and trying to create traffic jams by trying to give people tickets for not wearing a mask inside their cars. It's going to take a little more solid, approach. When I saw the approach at the Uttarakhand border, I looked at it and I told the man who was handling it, I said, what are you doing? You're putting these kids at risk, the ones who are standing in line. So he quickly went up there and he started making an announcement on the mic. I don't know if they can play out that video again. I want you to see what he started doing. But if you can play that video for me, please, from the Uttarakhand border again. Okay, whenever it's ready, please let me know when you're ready to play out that video. So, what I'm saying is that we need to be certain on how we're going to manage this. I decided I'm going to bring in three guests today. I'm going to start our guest by Dr. Prasun Chatterjee. He's an associate professor at All India Institute of Medical Sciences. Dr. Prasun, thank you for joining me, actually Prasun, sorry for the pronouncer, joining me for the show. Tell me from your perspective, how and where are we going wrong with our medical reaction to it, if I may call it that? Where is the biggest gap that you see? I know a lot of hospitals have done some great work, but where do you see the gap?
See, I think for me, sitting in AIMS, stating where is the gap is difficult. But what I can, even during my travel, also in between, I travel a lot. I saw even in recent past also, during my travel to my hospital, coming back home. Uh, Somehow I feel that if you try to understand how a pandemic prevented, how a pandemic can be managed, everything starts with dissemination of information. And I understand that all of us, government agency, non-government agency, private sector, everybody tried to give as much information they can spread. That message should be calculated to the last person. But I don't feel that happen, because nowadays, even in I see those who are wearing mask is something, sometimes I feel like a fashion statement. Look, I'm wearing this mask, that mask, and during the discussion, immediately they will just pull the mask down, and they will start discussion. Where actually, medically, if I say, when you are interacting with someone, you need to wear mask. You need to doubly sure that you are wearing the mask properly. So, but you just do a random survey anywhere. It's not Uttarakhand or Delhi or any parts of this country. Even somehow I'm seeing even educated people, including medical fraternity, what you rightly mentioned, they are not going for this very simple preventive strategy, which are social distancing, rather I'll say physical distancing, wearing mask, hand hygiene. So this is something really dangerous, and I don't know why it didn't percolate to the last person. I cannot, I don't know, like where is the gap, but I what I see is like, still we couldn't imbibe that quality, that behavior among the common people, that you must wear a mask, you must clean your hand as many times possible. Whenever you're coming home, you just change everything, take a bath, and consider everybody in this country can be an asymptomatic or symptomatic carrier, which you don't know actually still now. Second thing is, I feel, psychologically, we talk about, in a medical science, we talk about motivational interview. So there is another factor what you are bringing it. I think my next speaker will speak much better. The component of economy for a laborer who was staying, let's a 10 by 8 or 8 by 5 room with 5 members. For him, social distancing is practically impossible. For him, we have like, I am associated with an NGO through which we used to feed a lot of people. So I used to visit. They used to say it's fine to die of corona than starvation. So if this is the mentality, and why this mentality, I'm not the right person to discuss that. But then the desperancy among the people to go for the work, get something. And one more point I want to highlight, Rohit, here, that when we experts says that there is probable community spread, so even if there is no contact, you may have COVID. Then they think, so okay, even if without contact, if I can be contacted with COVID, then why to wear mask? And even there are a lot of infodemics, lot of misinformation which is
Right.
percolating through via social media, that no role of mask. Some doctors, suddenly I saw that there is no use of mask, I'm seeing everyday patient, I'm not wearing mask, I have not suffered from COVID. Such a
Wow.
ridiculous situation.
Wow, no,
So
it is a ridiculous statement to make. Absolutely, I think
uh,
Dr. Chatterjee, you made some very good points. Let me try and kind of restructure them so that people understand a bit. I think one of the bigger challenges also is people not recognizing the small places you can contract the virus. We have to protect ourselves from the virus until we have a vaccine. That's the first thing. We have to remember that. And that's something that we all have to, take steps on. Now, even though the information existed, but I didn't see like multiple language broadcasts being made, use of mass media to explain to people what happens. People have to be made responsible. You cannot run 1.3 billion people's social distancing through a policeman roaming around with a stick and putting them at risk as well, because they also don't really know as much. So the education constantly in multiple languages, in whatever way you can spread that information, and making people responsible that this is what will happen to you. So please recognize what you're going to do to yourself. As soon as you take on the role of being the little monitor of class with a stick in his hand, it's going to become very, very difficult. Now, let me bring in Dr. Pasundra. I'm going to, please stay with us. I'm going to bring in the others into the conversation. Uh, Arpita Mukherjee, she's a professor at the Indian Council for Research on International and Economic Relations. Professor Mukherjee, explain to me from your perspective, where do you think and how do you think this whole cycle of the economy is going to return? How do you see it unfolding?
See, after any return of the economy today, to certain extent, would be, how much people will be desperate to stay indoor and how fast the economy can revive post the vaccine. So we don't see much growth this year. Neither does RBI nor does the IMF. And if you see that we were growing at a positive 1.9, but in spite of the beginning of the COVID and the lockdown, and we suddenly became minus 4.5 with disruption of the supply chain forcefully due to geostatical strategical issues with China. So there are other issues that is hitting us as a part of our economic resurgence other than the COVID, and we need to take that also into account. While this situation in an economic perspective does offer India in the near run certain opportunities as well, because we are now manufacturing PPE kits almost on our own. 3 months, 4 months ago, we were actually importing everything. So we have lot renovated our manufacturing within the means to do certain things. It also has badly disrupted our supply chains and our abilities to develop new supply chains, and also will depend upon other FDIs that come into the country. Morale of the people are very low. There is a huge amount of unemployment. There is a need for people to go out. Many people have lost their jobs. So all of this is going to impact us, and nothing will move really before mid 2021.
Well, so you see the economy's turnaround is going to be much longer. Jayajit Bhattacharya, he's a professor at the IIT, also a former partner at KPMG. Jayajit, will you please explain to me, as you see this, as I look at this as a management issue, really. What I see here, the crisis of COVID and the handling of this crisis, I see a big, huge management gap. Do you see the same?
Yeah, for sure. I think sitting in August, I agree with you that things would have been handled better. And if you ask me what needs to be done in August, I can tell you better in the month of September as to what needs to be done, given that hindsight is obviously better. Keep in mind that there was a panic situation in March when we were given a communication that this COVID virus is going to be a massive pandemic, and it's going to be extremely destructive in its nature, and it's going to spread very, very rapidly. In the face of those half communications, half truths that came out, I think it became a matter of life and death to have an immediate imposition of the lockdown. But clearly, as more information about the pandemic started trickling in, perhaps we could have taken other steps, and perhaps we could have used some of the money that was being pumped into the economy to be distributed in a more direct manner. For example, in the first week of April, when the first tranche of $23 billion was being given out, the money hit the bank accounts of those who really need it very, very quickly. In the first week of April, it hit their bank accounts, and albeit it was very small amounts of rupees 2,000, 3,000, but it did hit them in their bank accounts, and it did provide some level of confidence. However, that is not clearly enough to run an economy, and that is not clearly enough when you've got 26% of the people unemployed in a gap of 2 to 3 months, 2 to 3 weeks. So from a unemployment rate of 6.7%, we hit 26% in a matter of 2 to 3 weeks. That's a huge shock. And then we have now gone back to the pre-COVID level of unemployment, but that's still not good enough because it has in its path left a huge amount of destruction. Also, I myself not convinced that the unemployment levels have gone back to pre-COVID because there will be a huge amount of underemployment hidden in it. There will be a huge amount of salary cuts hidden in it, and there will be a large number of MSMEs that have got completely destroyed. And therefore, coming back to your question that could we have managed the situation in a better way, had a larger focus on MSMEs? Perhaps yes, but I'm still scratching my head as to what would have been the actual action on the ground. From March onwards, I've been continuously on these debates, and it's been very, very difficult to really say that this tool or that tool would have impacted better, or it would have been better to open up the purse strings more, keeping in mind that we are still one of the poorest nations in the world. No matter
Right.
we have got
No,
the
no.
$3 trillion
Given that,
economy, or we will hit the $5
Vijay,
trillion economy. Even at 5 trillion,
absolutely.
we will be one of the poorest nations in the world. And therefore, our headspace to really manage the situation from a financial perspective is very, very limited. Also, given the fact that in March we were already facing headwinds in terms of our economy from a normal ceteris paribus situation. On
Mm,
top of it, we got hit by the virus. So it is a really difficult situation to manage. Too many constraints, too many things to balance. Jobs versus life, economy versus death coming from the virus. And even if I look at just pure economic numbers, you've got deaths of over 40,000 people. There is a
right.
value to death also. So if you multiply that value to 40,000, we have already lost a lot of people and a lot of the GDP because of those deaths. If I just keep a non-sentimental view of it and a purely economic view. So at some point in
Mm.
time, and as I said much early in March, that it'll be a race between how many people die of COVID and how many people die because of the economy. Very difficult call to take, Rohit.
You know, and that's why, people vote in governments, Jajit. So I worked for a year and a half in producing a film called The Pandemic. It is on Netflix right now. We released it in January, and we said that the pandemic was around the corner. This was the year of the mutation. That's what we're supposed to be working on. As a government, you're expecting. Even when we went out producing this film, there were multiple blocks for us to produce this film. They said, "What are you talking about? A pandemic? It's not here yet." Or, "What are you saying? It's just another year of disease. The mutation will happen and we'll deal with it." And we said, "No, but this is the year of the mutation." And so, uh, obviously, when we released the film on 20th, 22nd January 2020, and ever since then it's really, really unfolded, and people said, "Oh, yeah, 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 you were talking about it." So I think at some level we can always continue saying that, and that we could have done a better job, and obviously next month we'll know better. But really, that's what you invest in, and that's why people pay their taxes to you, to make sure that you deliver. You're an administrative service at the end of the day, and you must work on the future rather than working just on the present. It cannot just be reactive all the time. And I think one of our challenges, again, Jajit, and as you said rightly, is going to understand how you will resurrect the MSME sector. I was with somebody just yesterday. He's about 1,100 people. He had today. He's fired about 920 of them. He's left with just the balance of 180. Now, he said, "I don't know where that 20,000 crore that was promised is gone. I don't see it. I've had to shut down multiple businesses. I have received no money so far, nothing for paying to my employees, nothing to sustain my business." He's still making losses. And he's continuing to think about, should he shut down the rest of his business? And if you do not have a strategy, you do not have a planned strategy on who you're going to fund again to make sure that these businesses can get resurrected, then economy is not going to be in a great position to be. I'm going to go back to Dr. Chatterjee. Dr. Chatterjee, I know you're sitting at a medical facility and you're not there to, to kind of take, and talk about other places where what's happening. Now, I got a call yesterday from Jammu. One of my producers had 3 people die in her neighborhood with COVID. She said, it's becoming a little lackadaisical. Nobody came for sanitizing their facilities. Nobody came for testing the family members of the 3 people who were dead. Do you think there is a little sense of fatigue, and are we becoming more lazy, and that is why the spread of the disease was going to get faster?
I'd say it will be both, but what is most important, again, I'll repeat the same thing. Until unless the information has been percolated through proper channel to the proper person, this is bound to happen. It's all about, as you also rightly mentioned, is education, education, and education to protect the people from getting infected from this disease. So, as you rightly mentioned, someone, if a person has been infected, it is invariably we have to go and uh, test for all the family member. If we so why it is not happening in specific places, that as I mentioned, I'm not the right person, but this is a must. And I don't know, somehow people has this thought process that okay, it happens with the Mr. X, I will not suffer from this disease. This is
Mm.
also happening. And but let me tell you, it is very clearly, even a single case in this planet, we are not secure. Even a single case, it has to be, it's
Right.
like all on phenomenon. Everybody has to be without COVID, then only we'll say that we are fine from the pandemic. And it's our behavior, it's people's behavior. It's like a democratic way of approaching against this pandemic. It could be so. I have told in my previous discussion also repeatedly that it is a fight between humanity and the might of the virus. So my next door people is suffering. So, but if I'm thinking, no, no, I am fine. I need not to interfere. I need not to say,
No.
okay, just do sanitation to your home, get tested for other people. Please do that. Let me and we should not also stigmatize. There are many issues also. Many people are like intentionally they are telling, no, no, I'm not suffering from COVID. One of my patient who himself is a medico, who told, no, no, I'll not go for testing, I'm sure, because all my family members are positive, so I must be positive. If I do that, I will have lot of problem. People, my owner, house owner will say, just go out of the
Eh,
room.
yeah, empty the
Even they,
house.
you know,
Yeah.
and you
It was a
ask
challenge. There were a lot of medicos who got
market
thrown out of their homes across this country.
why it is required to be social distancing and masking. You should wear mask.
Right, right. So, it brings me to another point, Dr. Chatterjee. Now, let's say that, we really, really have to maintain social distancing for us to actually conquer it. And like you rightly said, until and unless the last patient in the world is cured, the virus is likely to come back. And obviously, until, especially if the vaccine is not there, then it's going to take, we won't be able to protect ourselves even in the future, because it can resurface, the virus can resurface out of people. Now, moving forward, what what is the step that needs to be taken? How do we bring back, the confidence? How do we kind of get people to, understand how serious this is? How do you communicate with your patients? How are you trying to convince them what they need to do? I know I've
No.
seen your hospital, and I see a lot of patients still floating around, and there is still a lot of crowd outside the hospital.
Right. Right. So we have definitely we have tried to streamline that. Initially we are doing teleconferencing and then telecall with the patient, and we are triaging who actually needs to visit hospital, and then we are bringing them. But again, it has to be just like virus. It has to be a chain reaction. I am transmitting information to you, you transmit to others. And remember one thing: this is not going to continue lifelong. It is a matter of, I will say, 3-4 months. Some expert may say four,
Right.
5 months, but it all depends on how we are behaving with ourselves. You, by wearing a mask, you are protecting yourself and you are protecting others. So it is like it has a multiple dividend. And I believe the corona crisis gives us a lot of great habit within us. We have become minimalistic. We started using sanitizer on and off, even doctors, which we don't used to do it. right? We have started distance, social distance, physical distance. I will not say social. Social connection has improved a lot, right?
Right.
So
Right.
so the way we have to find out, but only message is like we can actually fight against this pandemic. This is not going to continue for lifelong. It is a matter of few months only. Of course, I understand from economic perspective there are a lot of discussion we have to do, but you know, planning from the individual is very, very important, and for that you have to have adequate knowledge irrespective of your educational status, educational or
Right.
your social class. That is very, very important.
Dr. Mukherjee, I'm going to come to you. Explain to me from your perspective, what, if you were to give your guidance on how to deal with this, Dr. Arpita, what would you say we need to first do to get this back up?
Um, Rohit, if I was to give my guidance, I would have began in December 2019. With the Ministry of Finance, not now. In December 2019, when China and work, exactly the way Vietnam did, or probably New Zealand did, or Taiwan did, because Vietnam had a more intrinsic supply chain with China. So what they did is a few things. They made a lot of more stricter border control. They did more disciplined workforce, disciplined way of moving forward. They had a very structured way of keeping their economy open, and that is where they have probably, in spite of being more affected by the Wuhan slowdown, today they are much better than us, and they have been
Right.
able to. Many of these ASEAN countries have been able to contain the disease. So the systematic approach, when a global information you get, you work at a haste at that point in time. India does not have a pandemic management act. We have a national disaster management act. In India, pandemic is very difficult because health is a joint jurisdiction, right? So we need to have a framework for pandemic management, and that is something which we missed. Secondly, the framework to reach out to the possible people being impacted by the pandemic. We did reach out to farmers in March, but we did not reach out to the agricultural laborers or the migrant laborers and the SMEs. Worst thing
Right.
is that this pandemic told us that we don't have a SME database with the government. Neither we are aware of where the SMEs are in terms of their financial access and financial inclusion. So we need to have a more vibrant system of digital financial inclusion. And India being one of the tech leaders, this is the easiest that we can do. Third is that we have been for a long time, for the last 3 years, have been, jumping up and down with a data related national security and data related regulations, which is kind of sometimes restricting investment and not able us to share data and analyze data. So we need to be we need to have a data regulation in place, because here you are collecting a lot of sensitive data like patients data. Much of it we can't do in very forcefully because we don't ourselves have any regulations, huh? So that is one part of the storyline. Fourth is
You're,
that
you're absolutely right, Dr. Mukherjee. I'm gonna interrupt you there. You talked about data breach, and one of the biggest challenges for the Arogya Setu app, only to be downloaded by 8% of the population, was this whole concept of data breach. There were a lot of people who decided not to operate the app, delete the app after they did it, or whenever they downloaded it and then deleted it. It created massive challenges, and I think such kind of misinformation and just loose ends left created a management chaos, really, so to say. I'm going to play out this video. You talked about not having a management strategy. I'm going to play out this video from Kotdwar from yesterday, from 2 days ago when I was there. I captured it myself, so I can vouch that there is nothing wrong in the video. The video basically shows somebody telling people to social distance, but really what was happening was I had insisted on him to maintain social distancing so that we can go in and actually get tested. Please, let's take a look at the video.
पीछे पीछे चाहिए एक एक लाइन बनाओ खाली एक लाइन दो दो तीन तीन लाइन में मत आइए यहाँ पे भी एक लाइन यहाँ पे भी एक लाइन अरे सुनाई दे रहा भाई पीछे पीछे पढ़ो पीछे पीछे डिस्टेंसिंग में रहिए अब सुनाई दिया आपको
So if you see that man themselves and the policemen, they were sitting there in Kotdwar in Uttarakhand, they themselves weren't wearing a mask. If you see, the policeman puts up his mask. He was sitting next to that woman police constable, no mask on him, and then was angry that I was pointing it out. Instead, it should have been his own responsibility. He should have understood what he's doing, what an important job he's doing, of being a soldier for the country. Just doing a job is not the point. We would have rather taken in, volunteers who were serious about what they were doing, even if they were working 2-hour days. And I think handling a crisis like this through policemen is the worst strategy possible. I'm going to now go back to Jayjeet. Jayjeet, if there were the first few steps you had to take to resurrect the economy back, what would you do now?
I think clearly what's at this stage, what the understanding is that one should open up as soon as possible. And it has to happen in tandem with what Dr. Chatterjee was saying, educating people on how to manage a hygienic interaction. Imagine if you get into a metro where thousands of people packed in, and there are people who are wearing a mask which is just below the nose or hanging over the chin. That will lead to a much quicker spread, and again leading to a lockdown, which has to happen if there's a rapid spread of the virus. So clearly, a opening up in tandem with huge amount of communication, of education, of telling people how to behave socially in a COVID scenario. Just to give an example, I had to be in a government office this morning, and I was insisted upon that I must have a cup of tea. The official I was interacting with took umbrage that I kept on refusing the cup of tea. The fact of the matter is that if I have to have a cup of tea, I have to remove my mask, and those are cultural nuances that needs to change. Just because two people are meeting, it does not mean that if you keep the mask on, you're offending the other person. These cultural nuances have to change. So that's point number one: open up the economy with large amount of education, large amount of training of the people. Second, the economy doesn't run on thin air. The lifeblood of the economy is funding. It is finance. Much of the announcement that has happened has to get translated into hard money coming in. And when you're going to the banks, and this we're talking about brass tacks, and I think there is always a disconnect between policy and what happens on the ground. Policy says, please make sure that people are taking care of themselves. What happens on the ground is police peeping into the car and checking if people are wearing masks. Similarly, policy says that you must push money into the hands of MSMEs. What happens on the ground is banks saying, well, if you've taken a moratorium, then we don't think you are the right candidate to whom we can give any funding. Even though the government is saying, well, we will be the guarantor to that fund, but still funding is not reaching to those who really need it. And therefore, a deeper thought has to go in as to how we turn on the lifeblood of the economy by ensuring that funding goes through into the economy. And the third part of it, which is the basis of capitalism, which is land, capital, and third part is labor. We need to get the labor back where they need to be, which is back into the cities, or there's a great opportunity to create more cities. The number of cities that we have in India is clearly not sufficient for any of our aspirations. We're already busting the cities, trying to manage a $3 trillion economy. If we reach $5 trillion economy, we need at least 50 more cities. We don't have that. So instead of trying to get all the labor in, can we also try and use this opportunity to actually set up more industries where the labor is, rather than getting the labor into congested cities and jacking up the cost of living and so on and so forth. But the labor has to be looked at very, very carefully. We still don't have proper labor housing. If you're doing any construction work, there is no regulation which says that you must provide proper housing and proper education to the labor and the children. And therefore, what ends up happening is that the children of the laborer who are always by definition migrant will again become laborers, which is not something good for the economy, even in the long term. In fact, alluding back to what your own documentary on pandemic, you predicted that it's going to happen. Similarly, we have been predicting for a long time that we must have an economy where everybody needs to be educated. And if you're not having that, and if you're having the children of the laborers becoming laborers, again, we are not really having
skill
an economy.
development. Skill development. This was possibly a great opportunity to have the social, physical distancing, as Dr. Chatterjee talked about it, and then develop skills, because people may have sometimes literacy but zero skills to be able to do anything. And that's one of our bigger challenges, Jajit. I've seen constantly. I deal with a lot in rural India. I spend at least 3 days a week in rural India every week. And this is one of the big issues I face. So I think we are running towards the end of this show. Thank you, Jajit. Thank you, Dr. Chatterjee. Thank you, Dr. Arpita, for coming on this show and shedding a little light. I'm going to leave the show with a 1-minute video that has come out of the UN. I think it also talks about how we have to maintain our habitat, and it's going to be a very, very important part of who we are and how we move forward beyond us making sure that the last person has no virus left in them. So I'm going to leave you with this 1-minute video. Please take a look. And I think it's time for us to all think about what we will do post the pandemic. Obviously, putting our hands together and putting our thoughts together to fight this properly, and fighting this disease towards its end and creating the economy again. So thank you for joining me for the show, and over to the video.